Three amazing presentations from across the country on emerging issues. So I think they'll be very interesting. Thank you for those presenters for attending. But let's start with national updates. I think rather than calling on folks, if you want to just speak up, I know Kathy has something to share.
Absolutely. Thanks very much, Dr. Levy, and happy Friday, everybody. Just quickly, Humane Canada Summit for Animals starts next week. Only online registration is available any longer, but I will pop the link in the chat. And if you're interested, don't forget to sign up. It runs through the month of May.
Thank you.
Hi, everyone. It's Irene from Maddie's Fund, and a reminder that it is the last April 2022 community conversation. So get those entries in for the Maddie's Fund giveaways for joining us today. If you missed any April meetings, watch the recordings on demand through the Maddie's platform and enter the drawing for each view and each viewer. I'll drop the link in the chat. Thank you.
Good morning, everyone. I'm Dr. Sarah Pisano with Team Shelter USA, Maddie's Million Pet Challenge, and Open Door Veterinary Collective. And I want to thank Haas for the blog that came out yesterday or the day before. So I'm going to put the link in the chat. It's a great introduction to the Open Door concept, Access to Care Veterinary Clinic. Thanks.
Good morning, everybody. This is Jerica Owen with NACA. I first wanted to say it was great to see a lot of you last week at Expo. We had a great time. So thanks for everybody who came and said hi. And then the other thing I wanted to share is that yesterday, NACA, in partnership with Pet Hub, and also, thank you, Stacey, with the expert guidance from Michelson and Gina at the Michelson Found Animals, we have launched a survey. It went out yesterday. I'll put the link in the chat. We have a two-part survey. One is to pet parents and the other one is to animal welfare professionals. And we're asking about lost pet reunification strategies and technologies and how each of these different groups goes about finding their pets or helping to reunite their pets. And so we're hoping to really bridge the gap and find where those discrepancies are so we can target some training and really do some education around things that need to be shared more. So thank you for all the birthday wishes. Appreciate that all. So that's launched yesterday. I will put the link in the chat. Thank you. Have a great rest of your weekend, everybody.
Hi there, it's Valerie from the Association for Animal Welfare Advancement. Two quick things. On Wednesday, we kick off our new webinar series, A Great Place to Work, because everyone wants to have a great place to work. The series starts with Tracy Elliott from the Anti-Cruelty Society talking about having a leadership culture, and the rest of the series goes into ways that you can retain your staff, change your culture, and just hopefully make life easier for you and your employees. Second thing, you all heard this before, the association spring conference will be in Chicago, June 15th to 17th. We hope you'll attend. I'll put the link in the chat. We've got 4 different tracks, lots of CEs, and lots of chances to interact with your colleagues in person once again. So thank you.
Hi, this is Emily from the ASPCA. The ASPCA is partnering with the University of Minnesota's College of Vet Med and hosting a conference solely focused on access to veterinary care from October 17th and 19th in Minneapolis, Minnesota. We are currently accepting speaker proposals, so we encourage anyone who is working in access to veterinary care in any area of access to veterinary care to apply. And I will throw a link in the chat for the call for proposals.
Any other national updates? I'd just like to call attention to a great article posted by Humane Pro from Julie Falconer yesterday about the crisis in the veterinary workforce. It was a great summary from multiple points of view, talking about how we're losing so many veterinarians from the profession and not backfilling those positions. And it's affecting so many areas of the work we do, whether it's in shelters or community work that we're supporting. So there's some ideas for improvement, but none of them are quick fixes. And I know that all of us are impacted in our programs and ability to expand and do more work by this workforce shortage. But I thought she did a beautiful job summarizing it in language that everybody could understand, and it would be a good resource to have to share with folks that you are including as stakeholders in this issue. So with that, I would like to introduce our first speaker, Dr. Chumkee Aziz from the UC Davis Koret Shelter Medicine Program is going to explain the updated COVID exposure and quarantine guidelines that have been developed by the Shelter Medicine Academic Consortium. This is the veterinary schools, national organizations that have a veterinary focus. And it will be on updating the protocol around intaking and handling dogs and cats potentially exposed to SARS-CoV-2. So in our mind, we were mostly thinking about animals that are coming out of homes where a person is infected. And to start with, we would like to have a poll to tell us where everybody is on this. Amber, if you can start the poll, thank you. Recall that back in 2020, there was a national guideline to hold animals from COVID-exposed households for 14 days out of concern about whether they could be a source for transmission.
Thanks, Dr. Levy. Amber, I'll just wait for you and the poll results before starting.
Okay, great. Just a few more seconds. They're still coming in. Just a few.
So that if you're on the phone, you can't see it. The question is, how is your shelter or rescue handling animals coming from COVID-exposed households? And the answers are we're quarantined upon arrival. We used to quarantine, but no longer. We never quarantined or not applicable. If you have a different answer, please share it in the chat.
Are you all seeing the results now?
Yes.
Mm-hmm.
Perfect.
Just reading through the
Chumkee,
chat.
I think we can go from here.
Yeah, just reading through the chat, and it seems like folks aren't doing too much with animals who come in potentially exposed, which is in alignment with our guidelines. So as Dr. Levy mentioned, SMAC, the Shelter Medicine Academic Consortium, we got together at the beginning of COVID just to help navigate shelters through a lot of these unknowns around SARS-2 coronavirus and the impact on animals, because we didn't know on cats and dogs. But so initially, as Dr. Levy mentioned, there was we suggested a 14-day quarantine for dogs and cats coming into shelters, just out of an abundance of caution. And we shared those guidelines initially with CDC and AVMA, and they shared those out. Over time, though, what we found through research and experience in the field is our understanding of COVID and the impact on dogs and cats has become a lot clearer. And so more recently, we updated these COVID exposure guidelines to recommend that shelters eliminate any hold periods for animals potentially coming in from exposed homes. And the reason for this primarily has been that shelters are going back to normal operations, and we haven't seen adverse effects across the country. We're not seeing concerns about COVID or signs of COVID in animals, et cetera. So hopefully shelters, it sounds like folks are going back to normal. That is what's recommended at this point. Remember that, just some quick recaps. One is that, of course, human-to-human transmission is still the most important factor. And then just a few more recaps to elucidate what we know. So yes, we know that dogs and cats can get infected from humans, but they don't get sick. They don't get, especially in dogs, maybe a little bit in cats, but it's not significant. Both dogs and cats can get infected, but they don't shed for long periods of time. So there's no sustained spreading between dogs and cats, particularly dogs. And there's definitely just no evidence that dogs and cats are transmitting COVID back to humans. So again, the main risk remains human to humans.
And as you're taking in animals, if you're taking them in from exposed homes, it sounds like a lot of people aren't asking and people aren't telling when animals are coming into the shelter, which is completely okay. If you are getting animals in with upper respiratory or CIRD, canine infectious respiratory disease, handle those animals as you normally would with upper respiratory. No need to do anything special at this point. No need to bathe, no need to do prolonged quarantines. So we hope that this update that takes into account some more evidence that we've learned about in the recent times, and just more, again, knowledge about what's going on out there will help shelters as you continue to navigate through reopening and going back to normal. So if there are any questions, I can tackle them in the chat, but I'll go ahead and pass the mic over.
And we do have a few minutes for questions if anybody wants to ask of Chumkee. It sounds almost like our guidance came out after the fact, but you have confirmation if anybody asks now. So the field has self-corrected itself. I did see that Susan Shelter doesn't know if animals are coming in from exposed households or not, so they all get a bath. And that just sounds like a lovely shelter to work in, not for the bathers necessarily, but for everybody else who gets to work with newly bathed animals. Do note that we specifically did not include ferrets in this. Ferrets are probably a higher risk, and we just wanted to keep it really simple. Most of the information we have is for cats and dogs. And so that's what most people take in. So we thought that was helpful. Is anybody uncomfortable with this new guidance? I remember early in the pandemic, there was a lot of anxiety about the animal control officers who were going into homes to remove animals from households where people had died or were very sick and going to the hospital. And we had, recommended full PPE and meeting people on the sidewalk and things. Is anybody still hearing that from their staff, anxiety about COVID? There's a question about where's the guidance posted. Great, Amber. It's been posted there. Yes, anxiety about person to person. We all should have maintain our anxiety about transmission from person to person in shelters, and as in everywhere. That is definitely where the risk is still. And we did hear a little bit from Expo. I think it's a low level of transmission, but people are posting on the Expo Facebook group if they were infected. It doesn't sound like people are very sick, but it's very nice that they're transparent about it so we can all think about who we were sitting at the bar with and when.
And Julie, one more note that might be helpful is just a quick note about community cats. And just to reiterate, right, the virus doesn't have sustained spread between cats. And so the likelihood that community cats could become a reservoir or they could be a source of an outbreak is highly, highly unlikely. So really very little concern around community cats as well.
Agreed. And Emily asked a question, should people with COVID who want to keep their pets isolate from their pets while they are positive? Would you like to take that one?
Sure. Out of a caution of abundance, because we know humans can infect dogs and cats, it's just better to be safe than sorry, right? So if you know you have COVID, then go ahead and try to isolate. If other family members can help care for the dog or cat, out of abundance of caution, it's just better that way, if possible.
And then Cinda posted that there's a recent blog by Dr. Scott Weiss from Canada, and he's an expert in infectious diseases, and he has a very supportive interest in shelter operations as well. And he does have a somewhat different view on this, and so it's very good to look at his blog as well to kind of digest that not everybody's on the same page, but we're all good friends about it. And these are evolving recommendations as we learn more. Okay, Let's move on to the next presentation. Thank you, Chumkee. That's a really helpful update, and I'm sure that people are a little relieved that what they're doing for the most part is the right path. And for those of you who are still quarantining, you have the backup you need now if you want to stop.
Thanks, everybody.
All right, our next presentation will be very interesting. For an 85-year-old enforcement agency, change has always been difficult and complicated process for the County of Los Angeles Department of Animal Care and Control. 2020 was a pivotal year for the agency to bravely embrace managed admissions and become a community resource and provide alternatives to impoundment through its outreach programs. Deputy Director Dr. Maria Sabio-Solacito will share how 2 years into it, DACC is still on a path to being the change it needs. I'll turn it over to Maria. And she has slides to share.
Good morning, everyone. Let me sharing my slide. Is everybody seeing my slide?
Yes, we see it on, not on presenter. Show.
There you go. Thank you.
Mm-hmm. Good.
All right. So shall I start?
Yeah.
Okay. So Maria Solacito, I'm now a deputy director for the County of Department of Animal Care and Control. But previously I've held the role of senior veterinarian for 10 years. So I'm just venturing into a new role. So a little bit about the department for those who are not familiar with us. We are an old agency, established in 1937, and we serve the unincorporated areas. Plus, we have contracts with 4 cities in Los Angeles County across about 4,800 square miles, and we have 7 that are open, practically open, for business 24/7, 365 days a year, with a total of employees. This was the recent count that we had. It was 386. Annual animal intake was 61,057, but in 2021 it had dropped to 569, and we'll see those numbers later on. Our services included sheltering, business and licensing, field services, safety and disaster response, and of course, medical. Now, even before COVID, we as an agency have always known we were not working in the most optimum environment for us to make a difference in the lives of the communities and animals that we serve. But recognition of the needed change was really difficult for us to manage because of our size. And also with the number of animals that are coming into the care centers, even if we wanted to institute change, it was a real big challenge. And I think us here on this call probably could relate to that pre-COVID, we were heads above water all the time. And so even with this recognition, we were trying to position ourselves for the longest time to try more responsive. But again, how to get it done was a big question. And then COVID happened. For us, this was an opportunity to make this. I would not, discuss like the entire experience that the department had. I'm pretty sure you guys out there share the same experience, but as a result, we were able to embrace 2 major changes that impacted how we are now as an agency. Speaking about our managed intake programs, and also for managed intake, we we actually were set up to kind of embrace this change by our collaboration with Koret and Cindy Karsten. We were participating in the C4C bootcamp, and this was done in January 2020. So when the pandemic hit us in March, kind of set up, like our minds were set into the different possibilities of changing our sheltering model. So the different areas that we focused on when we did managed intake was, number one, community engagement. This was something very new to us. You know, being an enforcement agency for so long, there seemed to be a disconnect on how we were working with the community. I think there were a lot of trust issues. We did not trust the community, but with COVID, we learned how to develop collaborations by engaging our community members in being fosters, and being adopters, helping animals, and just be facilitating our adoptions. Another thing that we also learned and embraced during the pandemic was focusing on pet retention. We were so busy for years and years being the solution and being the answer to.
Hey, Maria, can I interrupt for just a moment? Your audio is breaking up a little bit. It might help if it's a bandwidth problem. If you turn off your video, it might help with your streaming.
If I turn off my video, would that?
We'll still see the slides. It's just
okay.
that.
Sorry.
Sometimes that helps.
Okay, let me do that. I know I've been having. Sorry. Yeah. Hold on. Whoops. How's that?
Your video is still on.
I can't.
It's hard. I know when you're sharing, sometimes you can't see the controls.
Left.
Maria, just hover over your name and there's an option that says stop video.
There you go.
Perfect. Let's try that.
All right. Okay. Where was I? Okay, pet retention. So we started working with pet owners. So looking at our numbers, we know that a huge percentage of animals that we take in are owner surrenders. So we started working with people who are coming in to surrender their pets to really find out the reasons why. And we were able to, provide them certain needs that promoted them keeping them with their pets. Also for the stray animals, this was something very new for the department. Actually, with dogs, to work with the community to facilitate reunification amongst themselves. When people find, if there's a good Samaritan, we did not to drop off the animals that they found, but rather giving them tools and helping them with different strategies on maybe locating the owners that are probably within their own communities. And also with regards to cats, we had to stop good Samaritans, well-meaning folks, to just keep collecting animals that they think are strays, and especially kittens, and then drop. But lastly, it was very clear for us, and we made sure that it was clear for the communities, that if there's any animal that is sick or injured, are deemed potentially dangerous, there's no question that we would take them in. Okay. Next slide. So with cats, got kittens campaign. And one of the things that we recognized is when people don't know what the processes are, you know, not just with the public, but with our own staff, you know, that was a big part of the problem. So we made sure that we created a decision tree is going to provide a staff and for our communities. And this is something that we made available on our website, and we distributed, you know, as flyers whenever people would call or bring in a, you know, a box of kittens to the care center. I would say that this was a huge challenge for our staff. In fact, buy-in from staff members was a little difficult because we even got feedback wherein our own staff would say, why are we making the public do our jobs? So this was something that we had to tackle, making sure that we're having conversations, making them understand that it is in the best interest of the cats and the kittens. And it's not just about us avoid doing something. So the year 2020, we were learning a lot of things on how to maneuver all the back and forth about COVID guidelines and also the surges. So we could not really develop a full program for 2020. Mid 2021, we were comfortable enough in launching a new, an enhanced adoption program where we started having self-scheduling of appointments and also come first served. This is very new for us as an agency because it used to be that we would allow people to just come in and also put their names as interested parties or what we call a commitment to adopt, where we would put a hold on animals for these people and adopt these animals that they showed interest in. But we also recognize that there is a significant percentage of sometimes these people not coming through and the animals are left and missing out on getting adopted by people that are coming into the care centers. In addition to this, we became more proactive, you know, because we were taking in less animals. We were able to do more proactive efforts in making sure that we're preparing animals, getting them all spayed and neutered and ready to go home. And this is actually something that we saw great value in because animals don't have to wait until they go through to get adopted. They're just basically placed a ready to go home area. And when people come in during their, they can walk through and just pick out any animal that they, you know, they would be a best fit for a new family member. Also, with regards to customer service, definitely there's a huge change because our staff members now have the time to dedicate like good conversations, you know, with adopters and counseling. That was something that we were never able to do before when we were just going through the lines of people trying to get them out as much as we can and going through the lines before the end of business day. And so I know this may not be like a really significant number because 2020 was kind of for us, but there had been a 21% of adoptions, 1% increase in adoptions in the same time frame, August to December, from 2020 to 2021. Now, moving on to the Pets Are Family programs, these are our outreach, community outreach programs, which started initially with the medical team, but it has expanded to a lot more. So these are the programs: Medical Helpline, which we started in 2020. And then we developed the Animal Care Foundation Care Voucher Program in 2021. And then we had a revision of the Spay Neuter Voucher Program. We had the Vets at the Park, the Pet Food Pantry, the Good Neighbor Cat Program, which I will be discussing next. So just a little bit of a background for the Medical Helpline. This was a counseling and an assistance call center that we had to put in place when we were doing managed intake. We knew that when we were, quote unquote, turning away people, we need to make sure that they are properly supported. And there was a lot of training that needs to that is needed to make sure that they are not being just told that no, we can't take your animals in. So enough that we had a couple of technicians and also a couple of animal control officers that had to be placed on a work from home accommodation. And we took that opportunity to make them to be able to do this counseling, and be able to provide the information to connect people with resources. And because we had this call center, which is, by the way, in addition to our departmental call centers that is concerned about calls about, stray dogs or, pick up a dead body or something. So this is totally different. It was more of like a specialized team to just address the animals that otherwise would be surrendered to our care centers. So as you can see, the number of calls that we've been getting, it is significantly increasing. So the Medical Helpline, we made it clear that it's not an emergency line, that is something that there needs to be a counseling portion that is involved. We also use to make sure that we're providing support for the fosters, the community fosters that we had at that time, and connecting them with services that can be provided at centers, and trying to find out if owners with the provision of resources. And this helpline was key in of our care voucher program, because they're able to triage the cases and also have the conversations with pet owners about partnerships. So the voucher program is a financial assistance program that provides support for veterinary services, grooming, boarding, compassionate euthanasia, supplies. So we launched this in February of 2021, and especially with regards to the veterinary services, which comprised about 95% of the vouchers that are issued, is that we have a conversation with pet owners that we cannot pay for full medical bills, but what we offer, there is actually a cap to the value of the voucher. It's $500, is the maximum amount that. But what we do is actually help pet owners also make those decisions that is very critical for their pets. Now, the other piece is that we also worked with local veterinarians, explaining to them the program and having them sign up and be a provider. And a lot of times our providers are giving discounts of the voucher. So this was a huge assistance to a lot of our pet owners. So this is 100% grant funded through the Animal Care Foundation and generous donations from different organizations. And in we were able to collect 185,300 donations. And for 2020, we signed up 246,000, to be used for this voucher program. In 2021, February to December, we have dispersed $182,000, and the first quarter of already dispersed 104,971. So we are still actively looking. So if there's anybody out there, we would happily accept support. Another program that we have is our spay neuter voucher program. We all spay neuter is key in the work that we do, and recognizing that that our old program, this program has been established years and years, but there were a lot of barriers for our community members to avail of the program. And so in May of 2021, we revised the program, removing requirements for proof of low income and also the proof of senior citizen status, which were the qualifying requirements in the old program. All we ask for is a proof of to be able to avail of the voucher. On top of that, we also included accommodations for the homeless. They cannot show us proof of residency. All we needed was, to ask the area that they would be at, and which ACC would be, and that would be the address that we would put on our records. So again, still for this voucher program, because it only serves the unincorporated LA County and participating contract cities. And currently, we only have 9 out of our 44 contract cities participating. So we're still doing a lot of convince them to be part of this. So in 2021, we issued 697 vouchers, and one of the things that we recognized is the availability of providers. Now, looking into our own medical operations, we know that because of intakes that we have, we for this spay neuter voucher program. So we doing public spay and neuters, which is a new thing for us. And looking at the numbers, the animals that were altered, publicly owned animals altered at our own care centers in 2021, 253, and you could significantly increasing in numbers in the first quarter for 2022. And this is continuously happening as part of our program centers to have a public spay and neuter day. Okay, so another program that we have is the Vet at the Park. We were able to set up a mobile veterinary unit at our local parks to provide medical and wellness service, and also offering our animal care voucher programs during these events. This was launched in June 2021 officially, but we did try it out in 2020, but because of the restrictions, that's something that we had to discontinue and restart it again in June 2021. It was also key that we were able to sign a memorandum of understanding of Parks and Recreation, because they would have the location, give access to our communities. And it's also important whenever you have these events to be able to provide amenities like restrooms. So it was actually very helpful that we were able to have access to the parks. And in starting next week, actually, we are going to start having, we're going to add services.
Hello. Hello. How are you?
a spay neuter, on top of the wellness programs. At the numbers, the pets served in 2021 event 44, and just in the first quarter of 2022, we're already exceeded that number. And and this is just 3 of the events that we've completed in the first events planned and scheduled for the rest of the year. With our Vets at the Park, we also have our pet food pantry. It's like distribution of quality pet food for our constituents. We have done this in association with our Vets at the Park, but we also have created like drive-throughs. This is, of course, made possible with our collaboration with Health Science Diet, who possible for us to purchase pet food with donation money at, like with a big discount, and good charities who has been very generous in giving us, pet food. We just had to make like application, and they notify us if they would have a sponsored shipment, and we would plan around the distribution of the supplies that we would receive. And so you can see that in the past 21, we've already distributed over $200,000 worth of supplies. Last but not the least is our Good Neighbor Cat program. We cannot really call it TNR because we know that we do not have the bandwidth of the trapping and and releasing of the animals. But again, because of the lower number of animal intake, we know that we have the capacity to provide the service. A lot of people are having difficulty to find, because of veterinary. So we worked with local organizations or rescue groups and developed a program that we would be the providers of these services, but they are the ones responsible to coordinate bringing in the animals and returning them to their communities. Numbers wise, in 2021, we were able to serve 353 cats. And again, 162. So again, this is something that we are continuously, but I think having good collaboration with local groups, it's a win-win situation for us. So impact.
Maria, I'm going to give you a 1-minute warning here.
Yes, I'm almost done.
Okay.
So managed intake, so you can see the numbers, how it had significantly drove down the numbers of animals that we, and live release significantly had increased from pre-COVID to 2021. And here are our 3-year stats. Euthanasia has been down mostly for cats, but for dogs, because we still need to take in all those injured, the sick, the percentage is not that significant, but we think you would see that it is a huge difference. 2019. That's all I have.
Thank you, Maria. That's amazing. And I see in the chat, everybody wants to learn about every one of these programs, and they're already imagining how they can fit into their programs. We don't have time to dig in and pick your brain the way we want to, but I'm wondering if we could start something on Maddie's Pet Forum to continue this discussion. Amber, maybe you could help us start that, or somebody who's good at that can do that. Also, many requests for a copy of your slides. Is it okay if Amber shares that with the group?
Yes.
Okay.
Thank you.
Congratulations on these programs. They just blow me away, and I see that for many, many people. One question I have is, how do you see sort of reopening and probably maybe what 2022 is going to look like. How is that going to impact any of these programs? Do you foresee that your shelters will become more crowded, or are you optimistic about just moving forward with these?
Probably takes, but what we are committed is to continue on with the model of managed intake and educating our stakeholders, our community members, because I believe that something that would help us along the way. We are definitely getting already, especially with the term opening. When are you going to open your shelters? Like, we were never closed. So that our conversations. But again, I think with the changes, because we truly believe in what we're doing.
Thank you for being so much of an inspiration, and let's continue this conversation.
Thank you for having us. Thank you.
All right, our next presenter is very interesting. So until recently, the Danville-Boyle County Humane Society in Kentucky took over 1,000 cats a year and euthanized most of them. In 2021, intake for cats plummeted to 19, and more than 1,000 community and owned cats were sterilized instead of entering the shelter. Team Shelter USA's Dr. Sarah Pisano will lead a discussion with Busy Ramsey and Carrie Koo to hear how the board and the shelter team overcame each challenge during this remarkable transition. So Sarah, take it away.
Thank you so much. And thanks for having us. There's sometimes shelters that we work with, and the stories are so amazing. When we make recommendations as consultants, we say, do this, and we expect some type of outcome. But these numbers make us go, you did what? So I want to introduce the fabulous Fitzy Ramsey. Was the president of the Danville-Boyle Humane Society in Kentucky when we met several years ago, and Carrie is now the director. And I want everyone to listen to their story, knowing that how they think and how they perceive all these programs is totally different than when we started a couple of years ago. So Fitzy, do you want me to start with the slide and then you can go from there and talk about the progression? You're on mute.
That would be great.
Okay, so I'm going to share my screen and strap on your seatbelts. Okay. There you go. Fitzy, take it away.
All right. So yeah, you go from a community of 10 million people to a community of 30,000. We have some different numbers, but it's scalable, as you can see. When Dr. Pisano first came into our facility, we were like, who is this lady? What's going on? Why is Best Friends asking for our shelter statistics? So, I mean, we were just kind of blindsided in some regards, but then she sat there and showed us graphics. Graphics give us a ton of information. I'm like, holy moly, like this makes sense. Why have we not done this before? And there was good reason, because we've always done it this way. And that was the answer I got every time I asked about any particular policy. Well, we've always done it this way, so don't worry about it. But what we were doing wasn't working. As you can see with the open admission, we maximized our adoption outlets. We had rescues pulling hundreds of cats, and still we were euthanizing, 500 cats in 2017. You go back to 2016, 600. You go back to 2014, and it's, nearly 1,000 cats being euthanized. And so obviously what we were doing, we were putting a ton of money into adoption outlets. We were putting a ton of money into driving back and forth to PetSmart. Everything that we were doing, we were just spinning our wheels, and nothing was stopping the cats from coming into our facility, especially those that are unadoptable. So Dr. Pisano comes in, shows us her fabulous playbook. I gotta put it over me.
Oh, thanks for the plug. Thank you.
Seriously, she came in, she gave us all these things, a checkbox, like this is what you need to do. This is what you need to do. Of course, there was a lot of resistance. We had some major, leadership issues. We had some major personnel issues that we had to overcome. But in the grand scheme of things, right after Dr. Pisano made her visit, we received a $20,000 PetSmart Charities grant to go towards our Kitties and Pitties program, which was kind of the start to our community cat program. And I mean, it was like divine intervention. I had applied for that grant before I met Dr. Pisano, and then it was like all arrows pointing to a community cat program. And then it rolled from there in terms of, you know, additional funding. All of our veterinarians in town were on board with assisting us. Basically, similar to LA, we had cat owners or cat caretakers take the pets to the veterinarians. We were not, the animal control officers were not doing this. We did not have an individual trapping cats. This was all community members. You know, we were deferring cats through free spay neuter, ear tipping, and vaccinations. And then, you know, it just built from there. We got Carrie on board. Let me move this out of the way.
Hey, Fitzy, let me take you back. You know what we did not explain to people, explain the relationship between the municipality, that you don't have enforcement, that you all share the building. Talk about that, because that was our major struggle in the beginning.
Yeah, so we're one of very few organizations in Central Kentucky where we are the nonprofit arm that owns the facility, basically upkeeps the facility, and the county, the municipality, works out of our facility. So they see intake, animal care and control, and then the Humane Society is on the outcome side in terms of adoption preparation, funding. And so you go back in time and we have like this little steno pad with one side with Humane Society responsibilities and the other side with the county. Yes, and we had no policies, we had no protocol. It was just basically whatever so-and-so did, you know, last year or the year before. So that was a big hurdle to overcome, was coming up with policies and procedures.
And Fitzy, did you want to share anything else? Share your screen and share anything else, or just this one?
Do you want to see the video?
Oh my gosh, how could I forget? All right, everybody get tissues, because this is a video that will knock your socks off. Yes, this is perfect timing.
Let's see, let's see, how do I?
Oh, I think I have to.
You can go to, I sent you the link.
Okay, yes, let me stop share for a second, and maybe if there's, while I'm pulling that up, if there's any other questions for Fitzy while we're waiting. Fitzy, you want to talk about ordinances? We had to change ordinances.
So in terms of ordinances, our county was kind of standoffish in the grand scheme of things, which was somewhat beneficial in allowing us to adopt best practices, including our animal control officers. So that was huge. They kind of left us to our own devices within our facility, and we didn't have a lot of you know, hand-holding from our magistrates, our county judge executive, which was extremely helpful. And so we're in the process of, you know, redefining some things. I think, you know, we actually have ordinances, which most counties in Kentucky do not, which is scary. But we do in fact have animal control ordinances, and we'll be working to better clarify community cat, as well as other things, basically not to really, you know, peg us into a corner, but more so to make things clear.
Sorry about that. Can everybody hear? Okay, sorry, Fitzy.
You're fine.
Love it. Thank you so much, Fitzy. And I'm going to just stop the share and see if there's, and we have 3 minutes left. If anybody has questions for Fitzy, or Fitzy, do you want to put your email in the chat in case anybody wants to get in touch with you? And Chris wants the link to the video, and if yes, I can put it in the chat.
Okay.
No questions for Fitzy? All right, well, know that if you're still struggling, here's the link to that video. If you are struggling with community CAP programs or struggling with ordinance revisions and elected officials, municipal officials, it is really the fiscally responsible thing to do. So remember to approach it from that respect when you're trying to change the mindset in your communities, and it's really the norm now. So hopefully there's no questions because everybody's doing this pathway of community cats. Thank you so much for having us. Thank you, Fitzy and Carrie and Danville Boyle. Amazing, amazing work.
Thank you all so much.
Oh, Julie, you're on mute.
Thanks to everyone who joined us today. It's been a great conversation. Let's continue this in Maddie's Pet Forum. And this session was hosted by Maddie's Million Pet Challenge. You can go to our website and learn about our consultations, mentorships, continuing education that we're offering. This is a collaboration between UC Davis, University of Florida, Open Door Veterinary Collective, and Team Shelter USA. So we have a great team covering all aspects of shelter operations and shelter medicine. So please have a look, and we'll see you next week. Thank you, everyone.
Thanks, everybody.